Наступна презентація. Next presentation, Magomed Lepshokov, carbon fiber peak in cervical spondylodiscitis, advantages and open questions.
Okay, thank you. Good afternoon, dear colleagues. At the first, I would like to thank organization committee for opportunity to participate on the meeting. My name is Magomed Lepshokov. I'm consultant in medical University Hospital in Saarland, and I would like to present today our study about using carbon fiber PEEK implants in cervical spondylodiscitis surgery. I have no potential conflicts or interests. The first about spondylodiscitis, it's as you know, as the last time we have a lot of cases, and we see increasing of the rate in the last years. In Germany, it's about 15 cases for 1,000 population, and actually it's old patients. Okay. I'm sorry. 1 second. Now. Can you see me now?
Yes, but we can see your presentation.
Now also. Okay. Good.
Okay.
Okay, thank you. Yes, about spondylodiscitis, and as you know, it's most of patients. It's patients with immunosuppression or patients in old age, about 65 years old, and with drug resistance or alcohol abuse. But cervical spondylodiscitis, it's very entity disease, and it's only from 6 to 28% of all cases of spondylodiscitis. However, the success of therapy, it's not high. We see the mortality remains about 20% or higher in the last study and publications. And we have today different therapy options. The first is empiric antibiotic therapy with broad spectrum antibioticum. And after the results of blood culture, we can change our antibiotic therapy and use persistent bacterial drugs, antibacterial medicaments. And if you see no success of antibiotic therapy, we perform surgery. We used guidelines, and the therapy duration for antibiotic therapy, it's about 6 weeks after the surgery, and on depend of patient. Sometimes if we have old patients, we can prolong it to for 12 weeks. And nowadays we use different implants in spine surgery. PEEK implants, it's a standard and most using implants. Titanium. You have different cages, expandable cages and stable cages. And the last years we use also carbon reinforced PEEK implants. Is a PEEK implants with carbon, and it's more strong. And the most advantage is these implants. It's these radiolucent implants, and it's very good for postoperative imaging and control. As you can see now on the X-ray, we don't see any implants. We can see only a marker. The same situation on the CT, and the difference between titanium implants and carbon implants, and it's a good option for MRI, because in MRI we have not a lot of artifacts. We have a little bit artifacts about this small marker, but we can see different regions. And the same situation axial view. For example, in MRI, you can see a lot of artifacts for titanium groups, and it's very, very rare for MRI. Okay, the aim of our study was to evaluate the clinical and radiological outcomes in patients with cervical spondylodiscitis We started surgical only with anterior surgery and using carbon fiber reinforced polyether ketone, as carbon PEEK implants and titanium implants. The study was the last 11 years. We look back for about 3,000 or 4,000 surgery with anterior approach, and we find only 30 cases with cervical spondylodiscitis. They had following inclusion criteria. The main inclusion criteria was anterior approach. It's only ACDF or ICCF plus cervical plate, and it was a group's only titan implants or only carbon PEEK implants. It's about surgical methods, and the patient characteristic. The patient had average age 64 years, and it was the same number of male and female. The main clinical presentation is neck pain, and we had about 40% patients with neurological deficits, and more 80% had comorbidities. It's cardiovascular disease, metabolic disease, and we had stratified with ASA classification. As you can see, it's about a third of patients with ASA 3 and 16% patients with ASA 4. In the preoperative setting, we did in all cases MRI and CT, and according MRI, we had a single segment involvement in 80% cases, and epidural and PMI also in 80% cases. It was very oft. We didn't see any significant difference between two groups, between titanium groups and carbon PEEK groups. What about antibiotic therapy? Antibiotic therapy, as you can see in carbon PEEK group, it was short duration antibiotic therapy, and we had about 40 days. And titanium groups antibiotic therapy was longer, about 2 months. And we had 3 cases in recuperation carbon PEEK group. The first case was with prevertebral abscess progression, and the second with recurrence infections, the same level, and the third case with prevertebral abscess progression and kyphotic deformity. On this slide, you can see clinical outcomes. We didn't have any difference in between both groups, as a main point, we assessed also postoperative imaging. We had about 56% by 56% patients. We had postoperative imaging with MRI, and we can compare different regions. In MRI, we look for prevertebral region, for intervertebral space, for ventral arachnoidal space, on spinal cord, posterior arachnoidal space, and posterior structure. And we compare in different groups, in titanium group and in carbon PEEK group, the information value in MRI, in sagittal view and in axial view. As you can see in axial view and sagittal view, prevertebral area, intervertebral disc space, and ventral subarachnoidal space in titanium group, we cannot see any also of structure. We cannot information value was about 0%, and the spinal cord we cannot see also in one patient. And as conclusion, in carbon fiber PEEK group, we can evaluate it, all of regions in MRI postoperative imaging. The open question, of course, it's the cost of implants, because it's very expensive implants, and the question, should we use these implants and to achieve the benefit, and which benefit we have if you use this implant? Of course, we have a better postoperative imaging, better control, and actually it's very good options for patients with suppressed immune reactivity or with patients in old age. Maybe we can use these implants as in narrow group for achieve the best results. And as conclusion, we have comparable long-term clinical outcomes between both groups, and carbon fiber PICC implants showed advantage in imaging postoperative and short antibiotic therapy duration. And the implant also demonstrated good biomechanical properties and excellent MRI compatibility. And the combination with early surgery and reliable imaging tools, it's key in managing this high-risk population. And of course, as you know, our success in therapy and in surgery, it's about the technology. And you can see in this slide the same material, but different technology to achieve the result. And the last image, it's Villeroy-Boch factory. It's a beautiful cap and plate. And actually, Villeroy-Boch company based in Saarland, and not far from our hospital. And we have in September a big neuroendoscopy week in the first module about minimal invasive spine surgery. And you are welcome to participate our course. And you can also to visit the Villeroy-Boch company and take some presents for yourself and for your wife. Thank you for attention, and please, questions.
Magomed, thank you very much for the nice presentation, being with us, and glad to see you again.